Lisa from BSN2A, and for today's video, I am going to demonstrate the subcutaneous injection. Prior to our first step, we are going to welcome the patient with a warm smile and greet them politely. This is to reduce their anxiety and gain trust and cooperation. Welcome, ma'am, to our facility. Please be seated and be comfortable. So, hi, ma'am. I am Dana Luis Tubinsa from Davao Oriental State University. So, I am the assigned nurse for today. So, today, ma'am, I will be administering subcutaneous injection. The subcutaneous injection, ma'am, is administered into vessels layer just below the epidermis and the dermis. According to the DOH, the MMR or the measles, mumps, rubella vaccines and MR or measles rubella vaccines are provided in powder for with diluents and must be reconstituted before they can be used. So both of these vaccines are live attenuated type of vaccines, and these are single dose subconsciously. So, and it is known of contraindications are for measles containing vaccine, known allergy to vaccine components that includes the neomycin and gelatin, pregnancy, and severe congenital or squared immune disorders. So it also includes the advanced HIV infections or the AIDS, and adverse reactions for mild fever, rash to 5 to 12 days, and the following administration for serious symptoms: the thrombocytopenia or the decrease of platelets, and anaphylaxis, and the encephalitis. So there are the Japanese encephalitis or the GE vaccines also protects the baby from against the viral encephalitis caused by Japanese encephalitis virus. The common type is live attenuated powdered vaccine mixed with a diluent provided in a separate vial by the manufacturer. So it also has the contraindications such as the known allergy to the vaccine or any of its components, and any condition that results to decrease or abdominal immune system response, the acute diseases such as the severe chronic diseases and chronic diseases with acute symptoms and or the fever, and it also has the adverse reactions with high fever in 5 to 7% of those vaccinated only. So that's all. Do you have any clarifications now or according to the vaccine? Step is to prepare the vaccine per agency policy. The next step is to prepare the vaccine as per agency policy and properly identify it, and because this ensures the safety of the patient. Make sure to check the vaccine name, the manufacturer, and expiry date. Properly do the hand hygiene using the ABHR that contains 70% of solution. Next is to clean the table and prepare the MMR vaccine to be used and the special syringe which contains the 0.05 ml. After doing that is to properly drape the curtains and closing the door for privacy of the patient. So the next step is to verify the vaccine administration record using the mother and baby booklet. Next is to verify the vaccine administration record using the mother and baby booklet to the client by asking the caregiver or the mother. So, ma'am, may I ask the name of the baby and his
She is
age?
Eileen and I am Justin, her
Okay,
gito
ma'am.
po.
Okay, ma'am. Her age, ma'am?
9 months po.
So, ma'am, is this the first time that the baby would receive this type of vaccine?
Yes.
So, is there any other immunodeficiency?
No. None.
Okay, ma'am. Thank you, ma'am. The next step is to select the appropriate site for administration. So, we assist the patient to position the baby in the cuddle position. Then, we check the arm and it should be free from any lesions, seizures, or moles. After checking, we do again the hand hygiene using the ABHR. Then wear gloves, the non-sterile gloves. Check the location. Select the appropriate site for administration. Assist the patient at the appropriate position. So, we remove the needle from the cup by pulling it off in a straight motion. Then grasp or pinch the area surrounding the injection site or spread the skin taut to at the site. So we hold the syringe in a dominant hand between the thumb and the forefinger, then insert the needle quickly at a 45-degree angle. After the needle is in place, release the tissue. Move your non-dominant hand to steady the end of the needle. With your dominant hand, inject the medication at a rate of 5 seconds per 0.5 ml. We should avoid moving the syringe, and keeping the needle steady will help keep the needle in place. Then withdraw the needle quickly at the same angle at which it was inserted. Then using a sterile gauze or cotton balls, apply gentle pressure at the site after the needle is withdrawn. We should not massage it because it is not necessary and can only damage underlying tissue. Recap the needle, and before discarding it, we should apply the safety shield or the cap to guard on the needle and dispose it in the sharp container. Then, we also discard the remaining supplies that we use, such as the gloves and the vaccine vial. So, the next step is to document the procedure and findings according to agency policy. The proper documentation helps ensure the patient safety, and we also document the time, date, location, and type of vaccine injected. Then, the last is to evaluate the patient's response to injection within the time frame. If there are any adverse effects, please do see me and report here immediately. So, ma'am,
Thank you so much. Nurse.
welcome, ma'am. So, we'll see each other again for the next 12 months. So that's all for today's video, and administering the vaccine using the subcutaneous